Hello and welcome to an exciting new video series on the U.S. healthcare system. Where do we go from here? So it'll be divided into four different parts. The first part is to look at the U.S. healthcare system and contrast it with other systems among developed countries. Second part is looking at Obamacare and the effects that it has had on healthcare system in this country. The third part is to look at Obamacare from the point of view of its critics. Where are the failings and are those criticisms legitimate? The fourth part is around alternatives, and specifically around Republican alternatives, because those are the ones that are going to get listened to at this time. So let's get started with the first part, the U.S. healthcare system and how it contrasts with most developed countries. Now, the structure of the U.S. system is quite different from other countries. Most people get their healthcare through insurance that's offered through their employers. That's around half of the people. And then for the rest, we have roughly 1 in 6 that are under Medicaid and around 1 out of 7 under Medicare. And then there's a small percentage of people who have non-group plans and who are getting their insurance through, privately. So in contrast with other countries, most of them have a system where the government provides the healthcare coverage, and it's not connected to an employer, it's just something that you have as a citizen. So you just go to the government clinic and they have arrangements for the amount that you pay for those services, etc. And the system with those countries are a lot more simple because you're talking about just one basic payer from this system. Now, the system I've been talking about, of course, is around universal health care. And with most developed countries, that's what they use today. You see that across Europe, most of the developed countries in Latin America, as well as Asia. And as you can see here, it's quite prevalent across most of the developed world. The implication, of course, being that it's universal. Everybody has access to healthcare, which is really great. Now let's just take a quick look at the broadest measure around how good healthcare is in different countries. And this reflects both lifestyle choices and the healthcare system itself and other factors, but it's around life expectancy. So when you chart it out, the United States is somewhere in the middle around these developed countries. We're right there next to Costa Rica and Chile. And you see that the countries at the top end are places like Switzerland and Japan. And the ones at the bottom end are, frankly, they're kind of borderline for being in the list of developed countries because they really are more in the developing world as well. So, and what's interesting here is that you can really tell that the United States is not getting a whole lot of bang for the buck. If you look at total costs, the United States is far and away having the highest percentage of its GDP toward healthcare compared to anybody else. And this started roughly in the early 80s, and it has just gotten worse and worse over time. And obviously the implications are significant because by spending so much money on healthcare, for example, it crowds out other things. Like if we have an employer system, maybe an employer would like to pay people higher wages than spending the money on employer-provided healthcare. Just one example. Now, what makes our US system just so expensive? I want to talk about that briefly because it should suggest some alternatives here. So the first one is around administrative overhead. The United States spends roughly a quarter of healthcare costs on administrative overhead, clearly the highest in the world. What is it about our administrative overhead that's different from other countries? Well, one of them has to do with having so many different insurance companies and Medicare and Medicaid and everybody else who gets involved. We have a system where it's possible to have a different cost for a service across each one of these different providers. Hellishly complicated to take care of that, having such different costs and having different billing procedures associated with each one. So that's just one easy example to understand here, but it's one reason why we're so much more expensive than anybody else. We also have billing that's a lot more detailed. So rather than focus on a treatment plan for somebody under a single cost, we will have an itemization for, the nurse each time they get a pill. Each time they get every little item that's part of that overall treatment plan. So having something that's detailed is great from an accounting point of view, I guess, but it's terrible from the point of view of keeping track of costs because it's just so expensive to keep doing that. So that's one area. Another area is around the frequency of tests and procedures. We prescribe way more tests than anybody else does. And one reason, well, people ask for them. We have an expectation that people should just get all the myriad tests and procedures that are possible and that we are entitled to them. So there's that expectation. Second one, doctors just tend to order them now, and they may be motivated for different reasons. Maybe they're trying to they're doing the right thing, and that's valid. Maybe they're doing it because they're trying to avoid an argument with the patient. Maybe they're doing it because they feel like to not do it could cause them trouble later in terms of litigation or even satisfaction scores, whatever. There are a lot of reasons. The third thing is around incentives. Because we're profit-driven in our healthcare system, it's clear that doctors have an incentive to be having more services and more procedures. Not every doctor does that, and I don't mean to apply that, but systemically, you do see more doctors who are prescribing more services, and it could be because there are profit incentives involved there. That's one area. Now, the next area is around salaries. So physicians in this country get paid more than physicians in almost every other country in the world. And it's especially true because we tend to have more specialists than general practitioners, which is different. Most countries are tilted more to general practitioners, and specialists make more money, so the salaries on the average are going to be higher. Similar story for nurses, although it's not quite as high compared to the rest of the world, but still, we do pay our nurses very handsomely as well. And then finally, drug costs. So we pay a lot for drugs, and there's been a lot of talk about it. Certainly, we hear a lot in the news about specific examples, and those are real, and it's systemic as well. We pay the highest for drug costs compared to anybody else. One reason for that I want to point out, and this is also a benefit to us, is that we have access to a lot of new drugs much sooner. So most of the rest of the world waits a bit longer because they would rather determine not only that a drug is safe and effective, but that a new drug is actually better than the older drug. And why is that important? Because it's cost-driven too. The new drug is often more expensive, is protected by patent, and so for them, they're like, maybe we should wait to make sure that this one's a lot better. In this country, we have a lot more influence from big pharma, and we have drug reps who will push and push for new drugs. And we have those drugs more available in this country to be used, and that's why it drives up costs. So I wanted to point all of this out because some of the solutions that our politicians should be thinking about should be linked to the very issues, the systemic issues that we have in this system that make things more expensive, and also regarding access to healthcare. Now, Obamacare is one way that people have dealt with access to healthcare, and I'll talk more about that. But I just want to make it clear that those are the kind of areas that we need to be talking about. So not just cost containment from a federal government point of view, but cost containment for all of us. So let's move to part 2, where we're going to talk about Obamacare and the effect that it has had on our healthcare system.